Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Sabila Urfaturrizqi from Medicine Universitas Islam Sultan Agung Semarang 2021 with name 301021000188. Now, I want to tell you about the scene of heart attack. At this time, I will tell you about the fourth material. At the first, I will tell you about introduction of heart attack. At the second is the symptom of the heart attack. At the third, how to heal heart attack. And the fourth is how to avoid heart attack. Okay, for the introduction, have you ever had a chest pain? If you often have experienced it, then do not underestimate it. This could be an early symptom of a heart attack, especially if you don't immediately go to the doctor. It will have a serious consequence. According to Dr. Evi Supriyadi, SPGDK, VHAA, VHSCC from Siloam Hospital Jambi, he explained that chest pain occurs in coronary heart disease. In this condition, we can recognize it by signs such as very serious heartburn, such as being stabbed, burned, or hit by a heavy object. In this case, the patient can relapse when he is doing strenuous or stressful activities. So, is all chest pain is a heart attack? Not at all. Not at all, chest pain is a symptom of heart attack. There are many symptoms that can be an indication of other disease, such as lung disease caused by blockage of blood vessels or pulmonary embolism, and inflammation of the membranes covering the lungs or pleuritis, and high pressure of blood vessels in the lungs or pulmonary hypertension or lung abscess, and as well as athletics or lungs collapse. Athletesis or lungs collapse. And then, how do we know the difference between chest pain symptoms of heart attack and other pain? The symptom of heart attack, we have three. First is feeling not comfortable on chest. Usually, heart attack can be felt as found of the chest that is likely to be in the middle of the chest and take several minutes, or the disease can be suddenly lost chest and appears. The second is upper body discomfort. Symptoms of heart attack may also include pain or discomfort on one or both arms, back, neck, jaw, or stomach. 3 is hard to breathe. This condition may be accompanied or not accompanied by uncomfortable taste in the chest, such as feeling stuck, heavy, or pierced needle. And the fourth is heavy. These symptoms are often described by sufferers as carrying a heavy burden on their chest. This condition is usually felt on the left side of the upper chest. However, sometimes it is also difficult to determine the right location. And the fifth is other significant signs. Another sign that might occur is called sweat, anxious feelings, nausea or dizziness, neck pain and pain in the left arm, jaw, the back, or the stomach, and one or both shoulders. Feel weak and have a fast or irregular heartbeat. Next is a symptom of ordinary chest pain. Pain in the chest can be very similar to heart attack. However, actually, the pain that occurs is not because of heart disease. Some conditions that cause chest pain there are: first, lung cancer can cause chest pain. This pain occurs when cancer cells have spread the ribs. And the second is muscle pain or breastbone due to increased physical activity. And the third is chest pain is caused by prolonged couch, which cause respiratory virus infections. The fourth is pain in the ribs is a sign of herpes zoster. Next is gastrointestinal disorders that cause chest pain. And then next is spondylolisthesis, because spinal nerve compression can cause chest pain. And the last is low blood pressure can cause blood pressure to be unstable, so the heart cannot pump blood faster, so that it causes pain. So, is there a cause of heart attack? A heart attack occurs when one or more coronary arteries are clogged. This disturbs blood supply to the heart because the essence of the heart needed the blood supply that contains oxygen. If the heart does not accept enough, heart of the heart muscle will be damaged. In general, submission in coronary arteries are caused by fat deposits that form plaque. This condition makes the arteries narrow, or is known as atherosclerosis. If it is not immediately treated by atherosclerosis, it can become a coronary artery. This disease causes a heart attack on someone. And now is heart attack factor. There are a number of factors that can cause a person to be able to risk coronary heart disease or heart attack, such as having the habit of consume alcoholic beverage. Second, many eat food containing saturated fat. Third, having chronic disease such as high blood pressure and diabetes. 5. Life with obesity. 5. Having a smoking habit. And 6 is have a family history with heart attack. And 7, little sports or physical activity. And 8 has a high level of stress. Oh my god. And 9, having autoimmune disease. And 10, the last is have a history of preeclampsia. If it has been affected by a heart attack, is there a way to heal? There are several ways which can overcome heart attack by doctor, such as operation and procedure for handling heart attack. Second, using drugs that have been prescribed by the doctor. Third is recovery after experiencing heart attack. Duration of recovery from heart attack is adjusted of the condition of patient who experience damage to the heart. Generally, people with heart attack will recover again after treatment for 2 weeks intensive. However, in some other people, it takes up to months. Are there a way to avoid heart disease? Yeah, there are several ways we can do to prevent heart attack, such as 1 is healthy lifestyle, so that from diabetes and hypertension. 2, choose healthy food. 3, stop smoking habits. And the last is maintain blood pressure. So guys, enough from me. Thank you for the attention and goodbye. See you next time. Wassalamualaikum warahmatullahi wabarakatuh.